So I just kind of want to touch on erectile dysfunction. Erectile dysfunction is a progressive disease. So that it means that we're going to have ongoing management, and you need to keep things up as we go along. And so you're just starting to show a little bit of difficulty either getting or maintaining erection or both. And so now we've got testosterone on board, and that was great for several years or a while, but it's still not quite what it was. You're looking for a little bit more optimization, or it is still just not to the level that you want it to be. Typically, I'll add a PDE5 inhibitor. My favorite is a daily Tadalafil. Sildenafil or Viagra is more of an as needed, where you take it 30 to 60 minutes prior to sexual activity, and it's a real quick, more robust response. But daily Tadalafil is good in a few things. One, you can take it daily. So it's just part of your routine. You don't have to try and plan anything that day. You don't have to lose the spontaneity of sex because you're taking it daily. You won't walk around with an erection all the time, but it should make it easier to get and maintain an erection if the situation presents itself. Additionally, it has some other benefits. It overall improves endothelial health, and so can actually work to improve erectile dysfunction rather than just masking it. I have had a lot of guys ask, well, do I become dependent on it? Do I need to be on it forever? And you don't get dependent on it, but if it seems to stop working, that means overall their erectile dysfunction is worsening. I wouldn't say it's more of a getting used to the med, it's just worsening of the erectile dysfunction. So one of the things that we need to do is, one, make sure you have an exercise regimen. Heart health is going to be directly related to penis health. And so if we can make sure that your heart is getting optimal workout, it should hopefully translate to overall erectile function. It is slow, meaning like the studies show that you do get benefits, but it can take 4 months of doing 40 minutes of activity 4 times a week. And so 4 months is a long time to really start, especially 4 days a week, for 40 minutes if you're not doing anything. So really, I just get you to start by walking. Let's get you breathing a little hard, get that heart pumping, and that's going to help start that to hopefully where we can get you to 40 minutes, 4 days a week, and do that consistently. And then sometimes you can even take additional prior to intercourse if needed. There are newer things coming out. Bromelanolatide or PT141 can be used as a nasal spray or an injection prior to intercourse. Sometimes that helps. It is FDA approved under a brand name medication called Vyleesi for females, but I have used it for guys occasionally, and they have benefits as well. There are some other stuff coming out that may help in the future that's really not out yet. But as it progresses, sometimes radial shockwave frequency is something that we can do where it's a device and it does, very mild shock waves to the penis, which helps break up the plaque that is limiting the blood flow, helps bring in growth factors, healing factors, and can hopefully help fill the cavernosum a little better to give you a better erection that's easier to get and maintain. There are kind of the more end stage. You could trial PRP to the penis if you've ever heard like the P shot. The literature is just kind of up in the air. They don't have tons of just super good studies. Some will show some benefits, some will show that they don't get much benefit. It doesn't seem to be very harmful, as PRP is, naturally in your blood, and we extract it, spin it down. And aside from the injection into the cavernosa on both sides, that's, mild trauma, you get numbed prior. And then Trimix injections are kind of the end stage, and this is a medication. It's 3 different medications, and it's injected at the base of the penis whenever you're ready to get an erection. And it typically works even if you're a poorly controlled diabetic, if you have uncontrolled blood pressure. Typically, it will still allow you to get an erection. And so that is another option that you have to talk with a specialist about that has worked with Trimix.